Hello, everyone. Welcome to our webinar, COVID-19 and University Response. We know this is a challenging time, and we appreciate you joining us for this webinar today. My name is Sarah Porter, and I'm the Vice President of External Affairs at Healthy Schools Campaign. Today, I'm representing the Healthy Green Schools and Colleges program, a partnership between Healthy Schools Campaign and Green Seal. Formerly called Green Clean Schools, this program leverages more than a decade of Healthy Schools Campaign's work, along with Green Seal's additional expertise, providing even more resources for creating healthy, sustainable, and effective cleaning programs. Before we begin, I'm going to quickly review some basics for today's webinar. Today's webinar will run for approximately 1 hour, and a recording of the webinar will be available to view later. We will email a link to the recording, and it will also be archived on the Healthy Green Schools and Colleges website. We're going to save the bulk of our time today for a question and answer session with our committee members. You can ask questions by typing a question into the questions box located on your control panel and clicking on the send button. Feel free to send questions through the questions box at any time during the presentations, and we will answer them during the Q&A session at the end. Throughout the webinar, you will also see a couple of poll questions. Each one will be a multiple choice question, and we will give you about 10 seconds to choose a response. So keep an eye out and be ready to answer when the questions come up. As you all know, colleges and universities closed campuses and quickly transitioned to online learning in response to COVID-19. Many colleges and universities are planning to welcome students back in some capacity this fall, and custodial teams are working around the clock to develop and implement policies and protocols to protect the health and safety of students and staff. The Healthy Green Schools and Colleges committee members graciously offered to share their experiences dealing with COVID-19 at their universities. Before we hear from them, let's pause and launch our first poll question so that we can try to tailor a bit of today's content and future webinars to what you, our audience, are most interested in hearing about. On your screen, you see a multiple choice question. We'll leave this up there for about 10 seconds so you can respond. What specific topic areas related to school opening would you most like to hear about today or in future webinars? Please be sure to check all responses that apply. Go ahead and do that now. We'll close this down in about 4, 3, 2, 1 second. Let's close it out and see where we landed. Okay, everyone, this is really helpful. It looks like 71% of folks on the webinar today have said that they're particularly interested in hearing more about strategies for proper cleaning and infection, along with addressing staffing challenges, and third, implementing CDC guidelines, and 45% on maintaining a green cleaning program in the face of COVID-19. We'll definitely keep that in mind as we move through today's program and also as we plan for next week's webinar and future webinars as well. Thanks all for your responses. Before we move on, please note the information shared during this webinar is for general informational purposes only. The experiences and information shared today are not intended to replace, directly supplement, or formally operationalize the guidance provided by the U.S. federal government, including recommendations published by the Centers for Disease Control, the Occupational Safety and Health Administration, and the U.S. Environmental Protection Agency. We encourage you to visit those federal agency web pages if you're seeking formal instruction on how to develop or update your cleaning protocols in response to COVID-19 or any public health emergency. We will include links to these resources in our follow-up email. Today's webinar is a knowledge sharing event in which the leaders of green cleaning and building operations in higher education will share their experiences. On the webinar today, we have Jodi Krause, Assistant Director of Housekeeping at the University of Wisconsin-Madison in Madison, Wisconsin, Kimberly Thomas, Director of Facilities Management at the University of Georgia in Athens, Georgia, and Aaron Uresti, Assistant Director of Custodial and Housekeeping Services in the Facilities Services Department at the University of California in Riverside, California. First, I'd like to introduce Jodi Krause from the University of Wisconsin-Madison. Jodi?
Thanks, Sarah. So as Sarah said, my name is Jodi. I have worked at UW-Madison Housing for 21 years. I'm currently an assistant director for housekeeping in the resident halls. UW-Madison serves 45,000 students. Housing itself has 31 buildings, which includes 29 resident halls and 2 dining halls. And housing, of course, also has our university apartments areas. In the dorms specifically, we typically house 7,800 residents, and our apartments typically house about 2,000. We employ 110 custodians in housekeeping within the dorms, working over first, second, and third shifts. Housekeeping also employs about 200 student custodians under normal circumstances. And the square footage of the halls specifically combined is roughly 3.5 million square feet. As you may have heard, UW-Madison has announced that it will reopen for the fall of 2020. Classes are going to be starting on September 2nd as planned. UW-Madison's plan is to hold both in-person and virtual learning classes, and plans are currently being laid out to limit the in-person class size, including using larger classrooms and auditoriums in order to provide physical distancing for students. Classes with more than 100 students and potentially any class with more than 50 students will be held via remote instruction. Class schedules are expanding this fall to include nights and weekends, and classes will be held in person until Thanksgiving, at which time the remaining 9 days of the semester will be online learning only. For housing specifically, what we are going to look like, our dining halls are going to be open, but they are going to be limited to use by the residents and the staff. So we have no outside events, which we have always historically allowed, no catering events. In our dining halls, we are going to be having some of our dine-in areas, but on a limited basis. So we are currently removing about half of the furniture from those spaces to allow for more physical distancing between tables. We are also installing barriers and increasing the number of hand sanitizer stations in our dining halls. And primarily for this fall, our grab and go options are going to be emphasized quite a bit for our students and our staff. 4 of our resident halls have dining or cafeterias within the building, and we will make the same changes in those spaces as well, so that we are serving only residents and staff in those spaces. We'll provide limited seating for dine-in, emphasize more of the grab and go options, and increasing the availability and location of hand sanitizer stations. We are going to be reducing the number of residents living in the halls. Most residents will have a roommate. We have let our residents know that they should expect to have a roommate. We have a number of single rooms, but most of our rooms are doubles. Historically, we have had triple rooms. We've actually dismantled those and turned them back into doubles. But we also have a small number of quad rooms, roughly 20 to 25. Those rooms will actually be turned into triples for this upcoming fall, given the amount of square footage in those rooms. The lounges, dens, and study spaces that we have within our buildings are all being rearranged currently. We are removing half of the furniture to allow for more physical distancing. And we are waiting to hear if the classrooms within our dorms will be open and in use by campus, but we are expecting that they will be. A little bit about our timeline. Our summer conference programs were canceled. So it's definitely given us the time to focus on projects that we had planned, in addition to ensuring that we can deep clean all of our areas prior to the students returning. We do still have students living with us in 2 of our halls. We have roughly 160 students living with us currently, and they should all be moved out by August 16th. We do actually have another move out scheduled this weekend. I think that'll be our 4th one so far. Move in is also going to be expanded, likely over a 2-week period. Historically, we do our move-in in about 3 days. Because classes start on September 2nd, we will have all of our rooms ready by the 18th of August. And there are a number of safety factors that will be in place when students arrive back, and staff are all fully welcome back to campus. So campus will be using surveillance testing, for example, to track the prevalence here on campus of the virus. They are setting up drop-in testing sites, and the university will employ contact tracers trained by public health department. In addition, face coverings are going to be required, to be worn in all indoor public spaces and in outdoor public spaces if distancing isn't possible. All students and staff in housing will be tested regularly. Our plan is every 2 weeks. Campus is working with us right now on a testing method that would not involve nasal swabs, but they are looking at the contact tracing and surveillance options as well for us. With our labor, we actually have been approved to fill our current vacancies, which was 9 staff, and we've been given approval to hire an additional 13 staff to assist with the increased cleaning or disinfection program. Part of our plans with labor do include closing down some of our resident areas within the dorms. So for example, our residents will not be able to use the kitchens or trash rooms this fall. We're going to reallocate that labor from those tasks to do additional cleaning. And we did this week get approval to hire some student workers for fall to help us cover our weekends. So currently what we're doing to support and try to get ready for reopening is rewriting and updating most of our policies. For example, our break rooms, going off of the square footage of each of our break rooms, we are changing them. Some we are relocating. Some we are removing the furniture to appropriately allow distance between staff. We already stagger our break times, and we are providing more sanitation options, hand sanitizer and hand sanitizer stations for our staff as well. Our cleaning and disinfection program is being updated. We will continue to clean our buildings, all of our areas, the same methods that we used prior to COVID-19. What we've added is a disinfection process for all of our spaces, focusing largely on the dining areas and bathrooms and any high touch surfaces in any shared space. So we have added the use of electrostatic sprayers for bathrooms and dining areas as an example. We're also working on updating and increasing training for our staff, being able to review policy updates with them, reviewing safety precautions. And we are currently working on a plan of how to keep our staff engaged. We have offered English classes for our staff, and we are not currently allowed to continue to offer those. Likewise, we are not able to have our staff meetings that we have normally had. So we are working with our translators to figure out how we can keep staff engaged, making sure that we are continuing to support them. Currently, our human resource team does weekly webinars or phone meetings to provide updates to all frontline staff using our translation services, and so those will continue. I would say that one of the biggest challenges in reopening or having our plans to reopen is really making sure that facilities have the supplies that are needed, whether that's masks or gowns or gloves or disinfecting products. And I would say that for us, we've been allowed to expand our purchasing to use vendors that we may not have been able to use previously, and that's really worked very well for us. We are actually receiving items quite regularly that we've ordered. And our campus does have an emergency operations group that also helps departments in need secure those supplies. I would say balancing the need of providing space for students while we're taking away other high-risk areas such as kitchens. Because we are closing the kitchens and removing the trash rooms, we're also removing furniture from dens. We are looking for ways to still be able to provide space for our students to go, not for social purposes, but for study purposes, as the academic buildings are also going to have to limit the number of students and staff that are in libraries, for example. So one of the things we did in not using the rooms for triples that we normally did is that would provide us another study space to open up for our students. And then addressing the need to have more labor. I'm sure we've all experienced, this increased need to clean and disinfect, and how do you do that if you can't increase labor? As I shared, we've actually been fortunate enough to be able to approve adding additional staff to offset the additional cleaning and disinfection that is going to be needed. And I know that not all facilities have that option. So one thing that I would make sure to look at, that we had looked at first before we got approval, was how could we reduce labor time and really prioritizing the tasks that have to be done. So in part, that's where some of the closing of the kitchens came in, or not using our trash rooms this year. If I don't have to have staff cleaning the kitchens and emptying the trash, it gives me more time to have them focusing on the bathrooms, the dining areas, and some of those areas that are truly needed. So.
Jodi, I'm going to jump in here. I thank you. I know that there's so much more, and you're working on so many preparations for this school year, and it sounds like you've got a great plan, but lots to execute. And I know folks are going to have lots of questions about what you've described. I'm going to pause this there so that we can introduce another speaker and hear from them. And again, we're going to have everyone, share some of what they're experiencing, and then leave lots of time for Q&A. So thank you, Jodi. Next, I'd like to introduce Kimberly Thomas from the University of Georgia in Athens, Georgia. Kim?
Good afternoon. I'm Kimberly Thomas. I'm the Senior Director of Services for University of Georgia Facilities Management Division. I've been with the university for going on 21 years. And spent about 6 years or so with Clark County School District, which is the K through 12 school district here. As far as the University of Georgia is concerned, we are about 60 miles east of Atlanta. We're the flagship institution for year research institution for the University System of Georgia. We have approximately 38,000 students and roughly 10,000 faculty and staff. And our campus has pretty much been closed to students since around late March, April. However, essential staff have been working throughout that time up until today, which includes our facility staff, police department, some finance and administration, and other key research departments who are assisting with doing a lot of research on COVID. Up till now, our campus has experienced about 107 COVID cases that have been documented by our university health. And we have had a few cases of our frontline staff who've been exposed, but it is a blessing with the low numbers considering just how much the numbers overall for coronavirus and COVID have blossomed here recently. A little bit about how the University of Georgia has decided to do our reopening of campus. We have decided to do a phased reopening that starts phase 1 for essential workers only. Everyone else around the campus have been teleworking, and that started June the 1st. Our phase 2, which would include essential workers continuing to work on a partial staffing level. So we bumped up the staffing a little bit. Teleworking options were still okay. That runs us through July, just after July 4th holiday. And then with phase 3, we are returning to full operations, including having students on campus. And that's due to begin around August the 1st. And just earlier this week, our university system did announce that our fall semester will start on August the 20th. However, face-to-face instruction will end at our Thanksgiving break around the close to the end of November, with no further face-to-face instruction on campus. The rest of the semester will be for online studies. As part of our campus reopening, I've shared quite a number of documents with Sarah, so those will be posted, including a 229-page reopening to full operations, which details a lot of the planning from the various working groups around the campus, which touches on everything from facility operations to our research, to business functions, academic units, and everything in between. So hopefully you'll have a time to try to look at some of that information. But just some of the highlights for our phase 2, the university has made a decision that they will supply all faculty, staff, and students with 2 cloth masks. These masks will be strongly encouraged for wearing, but the university system has decided to not make it mandatory. With our facilities management division, we have decided to make wearing masks mandatory due to our potential for moving through quite a number of campus buildings, as well as having a lot of contact with our customers, with each other, whether we're in shops or offices or working in spaces. So we have decided to make that a policy issue where it is mandatory for our staff to wear cloth masks. The university has also decided to give everyone a digital thermometer. We will not do mandatory supervisory thermometer readings, but they have made the decision to have quite a number of training sessions to show people how to self-monitor, self-check, and that includes why they gave them or will be giving them a digital thermometer along with 2 washable cloth masks. All of our supervisors around the campus, including facilities, have to take a mandatory online training course that covers information on COVID. It also has a risk assessment for how they can keep their respective workspaces, labs, and teaching areas safe, so that they can decide what type of PPE or personal protective equipment or social distancing or any type of janitorial or safety supplies that they need. They have who, what, where to do information that they can follow if there is a confirmed case of COVID among their staff. So it tells them what they need to do. If they have any questions, there's also been a development of a special campus advisory group where all staff can direct those questions to this group, which is comprised of our health professionals, safety professionals, academic and research units, as well as some people from facilities. And so this is a mandatory course that all supervisors have to take and certify that they pass. And they will also have an employee training. So we're trying to make sure that people really have a full understanding of how they can self-monitor and do self-checks for themselves. Part of that employee will have a affirmation page that they certify when they come to work. They are not showing any COVID symptoms when they report in. We have found out that our academic unit will extend our class change time by 5 minutes to give a little bit more encouragement for our students to walk instead of using our bus system. Along with what Jodi mentioned earlier, we will be installing a sanitation or disinfecting wipe stations throughout the campus and all of our facilities, including working with our auxiliary units, or 4-H, other off-campus departments and units, so that they are encouraged to use the approved Green Seal certified and CDC approved products that we have in our warehouse, so that we can limit the number of household products being brought to campus. We are working with a team with the academic units to provide social distancing inside of classrooms, and so that we're not going to be moving furniture, but the departments will be responsible for knowing how to seat the students inside of their spaces. A few other things that we did, notable changes. We have notified the campus that our APA standards will be lowered due to budget cuts and staffing reductions. And so they are aware that our custodial staff will be spending more time sanitizing and disinfecting in common areas for high touch point fixtures and areas. And we are encouraging individual staff holders to remove their own waste and recycling. See a few other things. We're working with our grounds department. They will assist us by disinfecting outside fixtures like handrails, crosswalk buttons, and things of that nature, while our custodial staff have their concentration on working inside. And in our warehouse, we are actively stocked up for 3 to 4 months of our high essential products, sanitation products, janitorial, and safety supplies. And I'll give the time over back to Sarah, and we'll take some questions if you have any for me later.
Thank you, Kim. I know that 7 or 8 minutes is hardly enough time to scratch the surface on all that you're doing, but appreciate what you've shared, and we'll definitely get to some questions in a bit. But before we move on to our final speaker, we're going to do one more poll question. This is going to work the same as the first one did. So on your screen, you see the question: what is the biggest challenge you face when planning for reopening? Please be sure to check all that apply, and we'll leave this up there for about 10 seconds. Okay, we'll close this down in about 4, 3, 2, 1. Okay, definitely helpful to see that, Jodi, you had touched on this, access to adequate supplies and equipment, definitely a concern for folks, as well as budget up there and finding practical ways to implement CDC guidelines. Just a quick note, if there are other challenges that you're thinking about that we've not covered, please go ahead and add those details to the questions box, because again, the information that we collect today will help inform some of the areas of focus for next week's webinar. So please definitely do share. Okay, thanks everyone for your responses. I would like to now introduce our final speaker, Uresti, from the Assistant Director of Custodial and Housekeeping Services from the University of California in Riverside. Aaron?
Thanks, Sarah, and thank you all for being with us today. My name is Aaron Uresti, and I'm the Assistant Director of Custodial and Housekeeping Services at the University of California, Riverside. I've been in the cleaning industry for about 20 years, and the majority of my career has been spent working on a university campus managing the day-to-day cleaning operations. UCR is one of 10 schools in the University of California school system, and we are located in Southern California, about 50 miles east of Los Angeles. We have about 25,000 students and 8,000 faculty and staff. Our team is responsible for cleaning the majority of the main campus and housing buildings, totaling about 6 million square feet of space across 200 buildings. We have a group of about 150 full-time custodians and 10 supervisors. Although our campus was officially closed on March 13th per state and county orders, 50% of our team remained on site supporting critical research in housing areas. On May 26th, we brought back our entire group to begin summer and fall preparations. Face masks and 6 feet of social distancing are campus requirements that we've been practicing for the past 3.5 months. In the last couple weeks, our campus has slowly started to reopen. Research areas began returning to work on June 8th. Last week, it was announced that our fall quarter, which runs from late September to mid-December, would be mostly remote, with some courses having in-person classes with about 25% occupancy in each classroom. The instruction models for the winter and spring quarters can change depending on how well our state and county does in managing the pandemic. Our campus is still in the planning stages of determining how administrative staff will return to work, which could be a hybrid model of working on site and remotely. So now that we have a general idea of what the fall quarter will look like, we've started working on various staffing and service scenarios to support the activity. We are planning to increase our current level of cleaning and disinfecting in public spaces. And we've also upgraded some of our equipment with the use of electrostatic sprayers to thoroughly treat high touch points in classrooms and in public spaces. We're also installing hand sanitizer dispensers in the main entrances of our buildings and in the classrooms that will be used in the fall. We're also looking at providing disinfecting wipes in classrooms for faculty and students to use throughout the day where the in-person instruction will be taking place. Procuring items such as wipes can be a challenge. I was just recently told by a few major manufacturers in the industry that they have shortages anywhere from 3 to 8 months on this particular product. So we're looking at some other alternatives as well. Another thing that we're doing is that we're also providing disinfecting kits to returning departments that contains an alcohol-based disinfectant, paper towels, and orange painter's tape if they wish to mark off areas where physical distancing may be needed. Our department also created an informational webpage for returning to campus that shares information on how to order the disinfecting kits, what our cleaning program will be during the summer, along with some custodial related cleaning and disinfecting FAQs. In order for us to ensure that we're executing our program as advertised, we took the initial closure period to make sure that our supervisors and staff were retrained on proper cleaning and disinfecting methods. This would include things like cleaning visibly soiled areas before disinfecting and following the proper dwell time of the product to ensure its effectiveness. We've also had to make sure that our program followed the CDC's guidance for cleaning and disinfecting in schools. Also, one thing that we found at the initial onset of COVID-19, we realized that the neutral disinfectant that we were using was not on the EPA's list of disinfectants for use against COVID-19, SARS-CoV-2. So we were able to make an immediate product switch to be in compliance. And since then, we've sought out safer products to use on the list that are either botanical, alcohol, or hydrogen peroxide based. As I mentioned before, we're being asked to develop a plan to increase the cleaning and disinfecting in public spaces and high-touch areas. At this point, we aren't sure what our staffing levels will look like in the fall, as budget scenarios are still being finalized. One thing that we did to help us understand our staffing capabilities was that we conducted a space analysis and workloading of our entire operation across all of our buildings. This allowed us to break down the number of FTEs that we have performing work in each type of space, combined with our current cleaning frequencies. We were then able to show how many additional FTEs would be needed to increase service levels, or on the other hand, where we may have to reduce services in other areas to offset the increase if we're not able to obtain additional resources. We hope to receive a decision on this soon so that we can begin to rebuild our employee work assignments before the quarter begins. The last thing that I wanted to touch on is keeping up the morale of our staff. We all know that this is our most important resource and that these are very difficult times for cleaning professionals like us. All eyes are on our teams to perform at a high level to help reduce the spread of COVID-19 and to protect the health and safety of our campus. We've been constantly working with our custodians to help them understand the importance of their role in infection control and that they are essential workers. We're making sure that our employees are well informed of any updates or changes, and that we're giving them an opportunity to share ideas about how they can be more effective under the new normal. As we all know, this pandemic situation that we've faced for the past 4 months has been very unpredictable, with changes happening on a daily basis. We want this increased communication with our staff to pay dividends when they are interacting with people returning to campus and discussing our enhanced cleaning and disinfection methods. That's all I have. Thank you for your time, and I hope that everybody is staying safe.
Thank you, Aaron, and I really appreciate that you touched on staff morale and really sounds like you're doing a lot to think about the well-being of your staff and make sure that they're very supported as they do this work. It's such an incredibly important role for keeping everyone safe. So thank you for that. To everyone for spending your time and speakers for your remarks today. We are going to move over to our Q&A session. Once again, if you haven't already, please go ahead and type your questions into the questions box on your GoToWebinar control panel and hit the send button. We're going to try to get to as many questions as we can today. I'd like to introduce Mark Bishop, another one of our committee members, who's going to be helping direct the questions during this session. Mark?
Great, thank you, Sarah. Let's just jump in. There are a bunch of questions, but I encourage you, please add more questions. Just type them into the question box and we'll get to as many as we can. So let me start with a general question. I'm going to direct this to Kim. Are you guys requiring flu shots in the fall? Kim, you there?
Yes, sorry, I had to unmute myself. Thank you. Thank you for the question, Mark. As far as students, they do have to go through a regular annual student health assessment that would include that. For employees, we are not requiring that. But as far as looking at the COVID symptoms, when the supervisors or the employees go through the mandatory return to work guidance and go through that training, that the symptoms and encouragement of taking a flu shot is in that guidance.
Okay, so you are recommending it but not requiring it.
That's correct.
Okay, thank you. And I'll just ask, Aaron or Kim, if you want to jump in, do you guys have similar or different approaches to flu shots?
This is Aaron. I would say it's similar. Most likely recommended, but not required. And there's even been some discussion about when a vaccine becomes available, if that's going to be, required or recommended. Mm-hmm. But no final decisions yet.
Okay. All right. Very good. Hey, Jodi, I'm going to ask you to jump in. You mentioned testing, and there was some clarity was asked. Are you talking about testing of all housing employees, housekeeping, or did it include other service workers and or administrative offices? Can you talk a little bit about that?
Sure. So campus is actually going to be instituting testing for all staff. So not just housekeeping staff. So every UW campus employee is going to be tested starting in the fall. So,
and is that every 2 weeks?
So per department, you can lay out your own testing. Housing has laid out that it would be every 2 weeks we would test staff. I can't say that like our athletic department will be doing the same for their staff, but campus is monitoring like what our decisions are, and it needs to be on a regular basis, continuously, yes.
Okay, great, thank you. Let's see, Aaron, do you have any specific resources or guidance that you use for proper disinfecting procedures, checklists for the specific types of rooms, the types of classrooms versus athletic areas, and anything that you'd be able to share?
We do. So before the onset of the pandemic, I would say last year, we created, kind of retooled our cleaning procedures that provide step-by-step instructions by space type. And so since this is everything's been occurring now with COVID, part of what I brought up earlier, we taken the time to kind of retool it again. Obviously looking at the CDC guidelines and trying to follow those as it pertains to cleaning and disinfecting. Other thing I would say that I mentioned in the presentation was following the EPA's List N. That's the list of disinfectants on the market right now that the EPA and the CDC are recommending for use against COVID-19. And, you know, there's several hundred different types of products on there, chemicals, wipes, etc. And, you know, one thing that we're trying to do is, you know, try to limit the exposure to not only our staff, but to the rest of the campus, and trying to find safer alternatives that are on that list. Some of which we've been able to find that don't even require PPE, but will effectively kill viruses. So those are the main topics, or the main things that we're looking at.
Okay, great, thanks, Aaron. And would you be able to share any of the lists, and including, to dovetail in another question, that list N? Can we make sure that we get a copy of that to Sarah so she can share it with all the participants?
Yes, absolutely.
Okay, great. And while I'm talking to you, Aaron, there's a question about your student kit. Can you speak a little bit to that?
Yeah, so the kit that I mentioned is actually a kit that's going to go to departments. So returning researchers or staff that we created with 3 items to basically help them share in the responsibility of, you know, cleaning their own spaces. As far as students are concerned, we've been looking at a couple different options. We were looking at a kit. We're also looking at maybe just providing supplies, whether it's wipes or, you know, disinfectant and paper towels in the classroom spaces, so they can also clean those areas, their seating area throughout the course of the day. Are also providing hand sanitizers inside of the classrooms as well.
Great, thanks, Aaron. And actually, I'm gonna be a little repetitious on this stuff. Aaron, can you share that with Sarah? Any information about those student kits? So if that sparks ideas, that we can share that with all the participants.
Yeah, so I believe Sarah did post our return to campus webpage that I mentioned. It's got some information. That has all of the information on the kits, our summer program, and then also some FAQs that we've been kind of getting asked about the course of the pandemic that we've posted on there as well.
Okay, great. Thank you, Aaron. Let me say, Jodi, question. There was a question brought up about your approach to using student custodians. And if you could share a little bit about how that program works, and how is that program different or the same, or how has it evolved in the era of COVID?
So we've had student workers, oh boy, my entire time here, and before I actually started working here, we always had student custodians in place. Over the years, it has definitely changed and developed based on the number of hours that our student staff were looking for. Historically, on average, we have about 200 student custodians per academic year. And we then also have student custodians that work for us in the summer. Our student employees were all basically dismissed in March, when our students were asked to go home and not return to campus. However, for this upcoming fall, we have been given permission to hire students. We know that we will only be able to hire fewer than we have in the past. So probably we're hoping between 50 and 100 students to work as custodians for us. And primarily they will be working the weekends, Saturdays and Sundays. Our full-time staff on first shift is scheduled Monday through Friday. So our students actually pick up the weekend work for us, cleaning the 29 buildings. Mark, did that help?
I'm not sure if we lost Mark. You might be on mute, Mark, or maybe we lost you.
Am I there? Am I back?
Now you're back. You're back.
Sorry about that. All right,
okay.
my follow-up, Jodi, was if you have any documentation on the program that you'd be able to share.
Yes, it might be a little bit. So for
Think
example,
about it.
Yep. Well, it's not that. It's just because we haven't been given a set number of students that we can hire, but I can share how many students we're going to have for this fall, but I can share information about our entire student custodial handbook and everything we train them on, what they do for us, what schedules normally look like. So there's a whole lot of that I can share. If it's specific to this fall, the only thing I don't know for this fall is what the actual number will be.
Okay, well, I think that's less important. I think giving people ideas would be great. Thank you. Get that to Sarah. All right, I'm going to keep going. I'm going to ask the question of Kim. What is your program doing to in terms of working with staff so that you are trying to maintain limits on group gatherings? Does your department have a role in helping maintain that?
Well, it's a really good question. One of the things that's in our supervisory mandatory training is that our departments are going to be charged with ensuring, as part of their risk assessment, social distancing inside of their department areas. One of the conversations that went back and forth between our working group across the campus and other powers that be is that we want to have our department heads and the academic deans have responsibility on trying to ensure that their staff are helping to follow social distancing guidelines. And what better way than to put that responsibility with them. And our communication and marketing group has already created quite a number of distancing guidelines that they can use across the campus. They just have to go to the marketing website, download little walk here, don't walk this area, or all employees must wash their hands when they return. A lot of different types of directional guidelines have already been created so the departments can use that information. Our staff will assist where we might be asked to do so, but according to the guidance, we felt it was important to have the department's leadership on that.
Okay, thank you. Very good. I'm going to keep going. How about Jodi? I'm going to ask you this question. A question just came up that said dorm rooms, and I know you focus on dorm rooms. Is dorm room cleaning frequency, is that part of your COVID-19 scenario and approach?
So not while they're occupied, no. We actually don't clean the individual resident rooms here at Madison. We have not historically either. We clean them after move out, basically, and then throughout the summer in preparation for the students to come back. So this upcoming fall, we will be providing kits to our residents to help assist them in doing their own cleaning. So probably similar to what Erin had put together for the various departments. But we don't go into the dorm rooms specifically to clean.
Okay. Thank you. And Erin, I'm going to address you on this. Here's the question, which might have suffered, which I believe suffered from some auto spell. If there is an outbreak within your department, do you have a response provolone, which I believe was fixed to protocol? So do you have a response protocol if you see an outbreak in your department?
We do. It's almost being finalized. We've worked with our EH&S department to create a protocol where we have either a suspected or a positive case on campus and how to go about addressing that.
I assume that Kim and Jodi, you guys have response protocols as well in the case of an outbreak?
We do at UGA, and that is part of the document that I shared. We detail that, but just quickly, the way we have it set up, we have asked our campus to enter a work order to us, and that's constantly monitored. We also have our emergency telephone number there so that we can have a tracking measurement so that we get that information. We send that to our building services leadership team. We have trained, I think, about 70 between 40 and 70 of our building supervisors, zone managers, state safety staff, so that we can have a quick strike team to assess that information, assess that space, and then we communicate with the contact person on what exactly and when we're going to go in. But the step-by-step outline of how we respond, PPE, and the products we use is outlined in that document.
Great. Jodi, anything you'd want to add to that question?
The only thing I guess I would add is that we do have quarantine and isolation spaces set up within our halls, specifically that we did in March. Those are being relocated to another extension building, basically a hotel run by the UW here, so that we can use the dorms for our residents. But our protocol has stayed the same, our response has stayed the same, and it's overseen by us as well as campus and our health department.
Okay, great. All right, here's a kind of a two-parter. I'll ask Aaron to jump in on this one. Who do you have any type of quality assurance validation of any type for your disinfection program? And part two is, how do you communicate that to the occupants of the facilities, whether it's tent cards on desk, tapes on wall, on door frames, whatever it may be, and so quality assurance and the communication of the quality assurance. Aaron.
That's a good question. So quality assurance wise, we have a software program that we've been using for a couple years where our supervisors will go in and do an inspection of an area with a mobile device and rate the quality, and then share those results with the custodian responsible for the area. They can then go back and address any deficiencies that are required to be fixed. As far as reporting to the campus, one thing that we've been doing recently, that's pretty much an internal system that we have, but one thing that we have done in our housing area during the course of one of our move out phases is Jodi can relate to, in March when our campus closed, when we were going in and we were deep cleaning or turning over residents' rooms, we were posting signage on the doors stating that the room has been properly cleaned and disinfected per CDC standards. So that way any incoming students, housing administration staff can verify that the work had been completed to CDC standards.
Okay, great. I think it's an important question. I'm going to just say, Jodi, if you have anything to add, I want to give you the opportunity to.
I would say one thing I would add for the quality assurance piece is we do make sure that we are also working with our University Health Services here on campus and the public health department. They actually review everything that we're doing, all the products that we're using. So I think that's an important piece for us, that we get that support. And then in terms of the communication, other than the signage, which is a lot of signage everywhere, kind of telling people what we do, our campus has a website link that has gone out to all of our residents and their parents, and so they can go and get specific information anytime about what we're doing step by step. That's what we're writing and sharing right now. So
okay, great. Aaron, I'm going to go back to another two-part question for you about electrostatic sprayers. First, generally, are you finding you use those, correct, Aaron?
We just started using them this month, as a matter of fact, yes.
Oh, okay. Well, then it does apply. With electrostatic sprayers, are you finding them to be cost effective in terms of saving time and resources? Two, what types of chemicals are you using in them, and do you need to wipe down after you spray, or can you just let it settle?
Yeah, so as far as effectiveness, what we've seen so far, and again, we're just kind of in the infancy stages, but what we've seen so far is yes, absolutely effective. It's a charged, it's a machine that's producing a charged chemical that is wrapping itself around a negatively charged surface. I would almost compare it to hand mopping versus an auto scrubber. More effective with the auto scrubber, you're actually, picking up dirt with a recovery tank. You're able to cover more square footage in a quicker amount of time. With an electrostatic sprayer, it's one trigger. You're pressing the trigger once, and you can go through, a set of double doors, let's just say, as opposed to squeezing a trigger multiple times out of a spray bottle. As far as drippage and things of that nature, I think it's just something that over time you're going to have to get used to, and through training. Similar to an auto scrubber, when you first start using it, you might see drip lines across, when you turn the corner of the hallway. With the electrostatic sprayer, it's you kind of have to find the sweet spot as far as how far you're spraying from the surface. I think the particular product that we have recommends a 2 to 3 foot distance between the surface and the unit. And again, if you're spraying that a foot away, you're gonna have more chemical that's going to be applied to the surface.
Okay. All right. Thank you. Question. I have a question to any of you right now. Please tell me: are any of you using UV lights for cleaning inspections or for cleaning? As part of your cleaning program, as part of your inspection, or as part of a disinfection in an HVAC system?
Can I answer briefly?
Yes.
Okay, so the answer for UW-Madison is no. I would share that we looked into the possibility, and it was not one that we thought would work based on the information we were able to gather, which would be some of the time it would take, negative benefits about not being able to be in the room, for so long after using the system. So that was one that was looked at and dismissed from us. And then if I could, I just wanted to share with the electrostatic sprayers, because we also just started using them as well. Depending on the one that you purchase, or depending on the ones that you purchase, if you purchase the right ones, you should be able to use any product. So the ones I purchased, I can use any product, any disinfectant that I want in the electrostatic sprayer, which I think is a benefit. That's why I went with the ones that we did. And as far as the rinse agent, that also depends on whether or not you have to rinse afterwards, depends on the product itself.
Okay.
And Mark, this is Kim. This is the same thing. We do use electrostatic sprayers, and we bought the type where we can use any product that we want in those as well. And as Jodi mentioned, in our COVID response, we use a product that does not require a rinse. But we do, if we wanted to use any of the other products that do require dwell time with a wipe down, we can use that as well. As far as UV lighting, we found that it was not going to be cost effective for us, either in our HVAC or our custodial usage.
Okay, great, thank you. Another question. This is more of if you can share information. There was questions about signage, COVID, hand washing, disinfection signage. If anyone has any examples of good signage that you are able to share, would you be willing to share with the group?
Yes.
Kim, yes. Okay. So
Yes.
Then I'm going to ask you guys, share what you can with Sarah, and I'm going to ask Sarah to organize and put all that information to share back out to the group.
No problem.
Okay, and then I have not been kicked off yet, so I'm going to keep asking questions, and then we'll probably have to wrap up after this question, though. Fitness facilities. Kim, what type of fitness facility, are you opening your fitness facilities? What type of cleaning protocols? How are you handling those areas of your facilities?
Well, at the University of Georgia, we definitely have quite a number of fitness facilities, including NCAA rated natatorium and student rec areas throughout the campus. Our rec sports works in conjunction with our staff. We provide them the guidelines. We do have staff that clean those areas. And with that, we are following a heightened level of disinfection and sanitation. So we do have that outlined in that guidance that I talked about. In some of our other athletic areas, we have our athletics department. They have their own custodial staff, but they are following the similar type of cleaning guidelines as what we're doing in facilities.
Okay.
Thank you, Kim and Mark. I'm gonna jump back in here. We thank you, everyone. We're at our full hour, and so we are going to wrap up. But I just want to thank, first of all, the sponsors of the Healthy Green Schools and Colleges program, including and especially Platinum sponsor Riverside for their continued support. On screen, you can see all of the companies that support our program, so thank you to them all. And thank you again, Jodi, Kim, Aaron, and Mark, for making time for this really important discussion. Thank you, everyone who joined us today. You can see my contact information here on the screen. Please do reach out if you have any questions. As I mentioned earlier, we are going to be using some of the themes that emerged from today's webinar to inform next week's webinar, which will be on June 30th, COVID-19 and school reopening. This webinar will be for both higher education and K-12 schools. Please join us if you can, or register to receive the recorded webinar. And a final reminder that we are going to be sending out an email, a follow-up email with a link to that for the recording for today's webinar, and links to several additional resources, including the ones that we mentioned today. We've already collected a number of them before today, and speakers will send more based on what came up in the conversation. We'll get those organized and send them out in the follow-up email, and they'll also be available on our Healthy Green Schools and Colleges website. So thank you, everyone, for your participation today. Stay safe and be well. Have a great day.